So a lot of this we had telegraphed. We knew the types of things that were niggling senators in their home bases, and we knew that they might be changed. No reaction, though, from healthcare stocks, pharmaceuticals, hospitals. Why, Drew?
I think most of these changes are relatively small, and a lot of them are focused on, trying to get as many votes in the Senate as possible and making sure that the markets that are under Obamacare or under the new Republican plan would be relatively stable. So when you look at these changes and what they are, essentially you've got, as you mentioned, $45 billion for opioid care and treatment and things like that. It also adds about $70 billion in money that we didn't know about before that would go toward essentially helping people who are either ill or particularly high cost or something like that, helping get them able to pay their health care costs under the new Republican plan. So a lot of what's going on here is essentially they're taking money that they had saved by reducing some of the spending growth in Medicaid and cutting some of the premium subsidies in Obamacare and putting it kind of back into that pool of insurance coverage and saying, okay, let's move over some of the the higher cost patients who are likely to have really high insurance premiums. Let's segregate them kind of off in their own pool, essentially what a lot of times is called a higher risk pool, and then allow other folks to have cheaper premiums because they're going to be the type of healthy people who can afford to buy skinny kind of low cost plans. So
essentially what we're getting here are some band-aids, if you like, for the little portions of the revised plan, the GOP plan, that senators didn't like. But what has the market priced in? Has the market already priced in this passing in some form, or will we get some kind of a major move if indeed there are enough senators to have something passed?
Yeah, it's interesting. I think, the companies that have been most sensitive to this in the markets have been hospital stocks. And the reason is that, I'll compare them to insurers real quickly. So if you're a health insurer, you have the option of basically just picking up and exiting the ACA or the Republican health plan if you want to. I mean, you can just say, we'll stop selling these plans in whatever state. And we've seen a lot of health insurers do that. I mean, all the news over the last year or two has been about insurers pulling out of this. Take your hospital or something. In the other case, you can't, exactly pick your hospital up and move it out of a state where the markets aren't functioning or when insurance rates aren't working. You are stuck there. So when Medicaid gets cut, Medicaid growth rates get cut, or people are going to have less comprehensive insurance plans, you're still stuck caring for those people. They're going to still show up at the hospital doors, and that's bad news for you. So that's where the sensitivity has been. I don't think the changes here are significant enough to really move them around, but that's where people have been watching.